So Dr. Sandhya, I would request you to kindly present your views, and many viewers are there who can really be benefited to inform you about the audience that you have made very, very useful videos, small videos for educating people, and which you have translated in many Indian languages. So that could be probably useful for us, and other than Spanish and other Arabic, which you are doing it, but Indian languages which you have been able to focus. So people are eager to, so I would request you to kindly start your deliberations, and I welcome you once again on behalf of NIDM and Government of India. Thank you.
Thank you so much, Professor Kumar, for the invitation to talk today and present my ideas on this Janandolan initiative that has been launched by Honourable Prime Minister Modi ji. And I'd like to say namaste to everybody and kia ora from New Zealand. So actually, I've entitled my talk today. Can you see my slide?
Yes.
We can. Yeah, okay. Okay.
We can see you. Go ahead.
Okay. So I've entitled my talk today, Fighting COVID-19 India, Self-Empowerment and Individual Responsibility for the Collective Good. And I think Major Bindalji and Kamal Kishorji both have, talked about this, and as has Professor Kumar, that, it is really every single person has a responsibility in this pandemic for the collective good. And so that is a very important thing for everybody to understand. And we need to basically remind ourselves of this, because this COVID-19 pandemic is a marathon. It's not a short-term race. And unfortunately, everybody around the world is getting a little bit fatigued, a little bit tired of having to, continuously take the precautions. But these precautions have to become a way of life and part of our normal behaviour until such time as a vaccine is developed and, we are all able to come out of this pandemic. So, basically, my view on this, Janandolan campaign for COVID India is basically that we all need to learn to live with the virus. As in, we need to learn what the rules are, what the parameters are that we need to make part of our daily living, so that we stay alive, basically, and well throughout this whole pandemic. We don't want to die from the virus. And, we have come a long way since the pandemic began, back in December last year. There has been a lot of progress in terms of treatments, in terms of our knowledge about, how we can mitigate risk and avoid getting the infection. So, this information, we need to learn to just make part of our daily living, so that we not only protect ourselves, but we protect everybody else at the same time. And the other very important message, which, Modi ji said when he announced this campaign, is together we will succeed. And that is absolutely correct, because only together can we succeed in getting this pandemic under control anywhere in the world, but particularly, relevant to India's situation at the moment. So actually the timing of this talk worked out quite well, because just a few days ago, I had the privilege of meeting the New Zealand Director General of Health, Dr. Ashley Bloomfield, who is the front man on the right-hand side of our Honourable Prime Minister Jacinda Ardern in our fight for COVID. And he shared some important lessons from the New Zealand COVID response. And three of the points that he shared, I think, are very relevant and something that can be applied to this campaign for India as well. So So just as the previous speakers have said, collective action is powerful, and that's what has worked in New Zealand and in many of the places which have controlled the pandemic. The other thing which he said, which is very important, and I don't think the other speakers have touched on it, and I'm very passionate about this, and I think it's extremely important, that he made the point that for an effective public health action, you need to help people understand why. So, in order to motivate behaviour change, for things to become habit, people have to understand why they have to do it. And the third point, which I thought was very, very good, was that in a pandemic, and in the current pandemic, there's not much that we can control. I mean, really, and people can start feeling very, demotivated and think, oh, well, there's nothing in my control. But Dr. Bloomfield made a very salient point, and that is there is always something that we can control, and that is our behaviours. And our behaviours is exactly what will help control this pandemic and protect not only us, but everyone around us. So that's the basic gist of what my talk is today, is that I would like to quickly go back over and remind everybody why it is that we are doing the behaviours of the wearing masks, the washing hands, the watching the distance, and just a few more extra points that we've learned about this virus that are very important for people in India to be aware of, especially heading into the festival season with, as Professor Kumar said, all the festivities coming up and the behaviours that go along with them, of people collecting in groups, of, people singing, people embracing, and also the fact for India and, the Northern Hemisphere, as you head into winter, a lot of activities will be taking place indoors. Also, in India at the moment, particularly in the north, I know that there is an issue of pollution. And of course, there is the decreasing temperature and the impact that has on the longevity and how long the virus lasts. So, yeah. So just I'd like to, remind everybody that actually this COVID-19 pandemic is accelerating. It's growing at a rapid exponential rate. So, the case numbers are increasing, but they're increasing exponentially. And this is all to do with this, this what they call the R0, or the reproductive rate of COVID-19. And for people who don't know what that means, it basically means that one person who's infected, it was thought that basically if somebody has COVID, they can infect 2 to 3 other people. And then those people can then go to infect 2 or 3 other people, and so on and so forth, till you have, as we have here, this, exponentially increasing number of people infected with COVID, which is what's happened. I think last Monday, the world hit over 40 million cases. And I think within a week, we're up to, we've increased by another 5 million. Now, in reality, actually the spread is, more around 5 or 6. But in some situations where the conditions are ideal for the virus to spread, which I will touch on, so-called super spreading events. I think there is one in Korea where they think that one person was basically responsible for 5,000 other people getting infected, via this, chain. So one of the big focuses of being able to control the pandemic, in the long term, and particularly in relevance to the place where India is at the moment, and it's something that countries like Japan and Korea have focused on very well, is controlling these risk factors for these super spreading events, because the nature of COVID-19 spread is that it tends to occur in clusters. So you see it happening in, places where people gather for weddings, for funerals, for celebrations, sports games, gyms, etc., so on and so forth. And the other point I'd like to highlight here, which I think people are becoming very complacent in India, because, they think, well, a lot of people are getting infected and it's all going to be okay, chalega, theek hoga, and herd immunity ho jayega. It's not true. Scientifically, according to whatever understanding there is at the moment, there is no herd immunity possible unless and until there is a vaccine. And that is simply because that the immunity that you get from having a COVID infection is not long lasting. And we are only seeing the evidence of that now because this is a fairly new pandemic, obviously. So, when people recently repeated the antibody levels in, people that had been infected in the UK, they found that the antibody levels had dropped, within the last few months. So, and there have been cases of reinfection. So, hoping for herd immunity and just throwing all caution to the wind and not following the rules to protect yourself and others is, going to lead to, people, loved ones becoming ill and, having bad outcomes. So this is a good reminder that basically if you have no collective response, that the cases will rise. But if you have a collective response, then you will manage to flatten the curve. But India, I would say at the moment, is, at that point where, you had sort of a first spike, and, because you had the lockdown and things sort of maybe settled down a bit. But now what's happening is that, the numbers are rising again, basically. So it's time, and it's very timely that, you've announced this, Janandolan, to try and get things back under control. Now, I mean, why should I change my behaviour? Why should I change my behaviour? I mean, people, think that only 1 in 5 people actually end up needing hospital level care. So, 20% of cases. So if you think about COVID, I mean, you think about it as, this iceberg where there's all these cases which we don't know about, where people had asymptomatic infections or there may be mild infections. And then you have your moderate cases, your severe cases, and then, of course, in the big scheme of things of the total number of cases, sure, it's, a minority that actually die. But the issue is that we all know that although there are certain groups which are at higher risk of having a bad outcome with COVID, we've all heard and read cases where somebody who was previously fit and healthy and young had a bad outcome and died from COVID. So really, the difference in terms of having asymptomatic, a mild, a moderate, severe case or dying from COVID is luck. So, I mean, a good enough reason to change your behaviour is that you don't want to leave your fate up to luck. I mean, why would you when there is so much at stake? So that is very important. The other point, as from the previous slide, the point of, keeping the cases under control is because when it doesn't, basically you exhaust your resources in terms of the hospital system collapses. Now, what happens in those situations is, if say you are in this group of moderate case where, maybe you needed some oxygen and some treatment in hospital in order to survive. But suddenly, because nobody followed precautions and the hospital system became overwhelmed, and understanding that healthcare workers are getting infected at high rates, and, they are not a never-ending resource. I mean, it takes years and years to train one doctor, for example, or specialist. So you need to preserve these resources because suddenly that moderate case that needs oxygen can't get a bed and they end up having a very poor outcome. So we need to avoid overwhelming the hospital system at all cost. Otherwise, for example, I just read yesterday the unfortunate circumstances affecting a small country like Belgium, where in a population of 11 million, currently 300,000 people have active COVID infections, and they are 10 days off having a totally overwhelmed health system and looking at a situation where they might have to end up sending patients to Germany until such time that Germany accepts the patients. But then after that, what do you do? So in India's circumstance, I mean, I know that previously Modi ji has, talked about this Atmanirbhar Bharat. And I mean, this is the need of the hour. Everyone needs to be self-sufficient and self-reliant and understand how to protect themselves, their family, and in doing so, they will be protecting everybody. Now, it's very important in order to motivate behavior that you understand what is the enemy here, what are we fighting, what is the science behind this? Now, especially in India, where there is a lot of community cases of COVID, it's very important to understand how it is that you actually contract the infection and what it actually does, because it's, becoming paranoid or thinking that, there's a lot of virus particles around, and just by, being out and about, I will get it. That's not actually the case. So basically, COVID-19 is an RNA virus, so it looks something like this. It has this RNA, which is the genetic material that helps it replicate. It has a protein shell and it has a fatty envelope around the outside. Now, this fatty envelope is the virus's point of weakness, which we need to exploit. Because basically, if you wash your hands for 20 seconds with soap and water and dry them well, or use alcohol, 60% alcohol or greater based hand sanitizer, then you will disrupt this fatty envelope and you will deactivate the virus, and it will not, cause you any harm. Now, say you don't do that. The way in which you get infected is if these virus particles enter through your eyes, nose, or mouth, usually, by touching your face with unclean hands. Now, scientifically, what happens here is that in this outer layer, you have these spike proteins, and they are like a key. And basically, the lock is these ACE2 receptors, which sit, in great concentration on the cells lining your upper respiratory tract, so inside your nose and your mouth, on your tongue. And also there are, ACE receptor, these ACE receptor cells in different parts of your body. And this is why, it can attack virtually every organ in the body. But this is the entry point. So basically what happens is this virus enters, the protein shell finds this, the spike protein finds this little receptor, which is the lock. The key fits in, it opens the cell, and that's what the virus needs to replicate. It needs access to our cells, okay? And once one virus particle accesses that cell, that virus particle, just like the previous diagram where I showed how one person spreads it, exactly in the same way, that virus replicates in an exponential manner, and then you have so many virus particles for your body to deal with. And I will talk about this issue and why, all these risk mitigation strategies of washing hands, watching your distance, and wearing masks are important, not only to avoid getting infected in the first place, it's also very important because it will, even if you are unlucky enough to get infected, using these measures will help reduce the viral load. So even if you can reduce, the virus particles by, 1, 2, 3, or 100, that will mean that there will be that many less virus particles that your body, your immune system has to fight off. So that is very, very important for everybody to understand. And actually, I have summarized this in a cartoon, which is available on my YouTube. So even a child or any member of your family could understand. And I have this in both English and Hindi in a short cartoon, just to explain the basic science of COVID. Now, as I mentioned, COVID, once it enters, it can affect basically most systems in your body. But importantly, if we are able to, we do get infected, and if we are able to fight it up here in the upper respiratory tract, then hopefully, with strong immunity, we can prevent all of this occurring. So, I don't think there's any other picture that is more scary or more that could provide more motivation for people to take care. We've seen people, get all sorts of bad long-term effects from COVID as well. I mean, it's not just getting infected, it's people get infected for a long, they don't recover, or they have what they call at the moment long COVID, where they have lasting, fatigue or, medical issues that we're still learning about. So having said that, there's basically, this COVID triangle for us to understand. So we have the virus, which we can't really change. Then we have ourselves, the host, where the virus is trying to enter. And then we have our environment. So we can't really change the virus, but we can reduce our risks by modifying our environment. So, being careful where we allow ourselves to be exposed and how we behave in those environments. And as a host factor, I would like to say that, this pandemic, one of the biggest things that have come out of it is that people are actually thinking about their health. And so as a host, I think it's a very important reminder and should be part of this Janandolan movement that we need to build our fortress and make sure that we are in peak health and immunity so that we can fight the virus to the best of our ability. So, just to reiterate, there are three ways in which the virus is, transmitted. Obviously surface transmission is there and more significant if you have somebody in your household that is infected, or you're living in a city where there is a lot of community spread, such as India, such as many of the places in India in the red zones. But mainly it was thought to be through droplets, which is, the respiratory particles that we release when, we cough, sneeze, talk. But recently, and it had been contentious, that aerosols is becoming, which are the smaller particles that are released even when we just breathe or talk. They are also very important. And that is why the fourth issue in terms of risk mitigation, apart from washing hands, watching distance and wearing masks, is watching ventilation because of these aerosols. So it's very important. So to explain the aerosols, this is a very good article that just came out with these illustrations where basically, your respiratory droplet that we were, obsessed with initially are particles that are, larger than 300 micrometers, and they generally fall to the ground, before that 2 meters. And that's the reason for the, the 2 meters social distancing. But aerosols are the particles that are less than 100 micrometers, and they can remain suspended in the air for hours. And you can think of it like smoke. If somebody was smoking, you can think of those particles like that smoke if you wanted to try and visualize them. And the important thing to understand is that the amount of aerosols that we emit increase in amount and concentration depending on the volume of the person speaking and the duration the person is in the room. So so you can see in this diagram how the particles are increasing after 15 minutes and then an hour. And the maximum particles is if this person has been singing for an hour in this room and no windows have opened. So here they've got 50 times more particles than they had sitting silent, just one person in a short period of time. And this is something very, very important for people to understand in order to, reduce their risk of getting COVID and getting a high viral load of COVID. So, as I said, countries like Japan and have done very well in trying to, educate the public to try and reduce the risk of super spreading events. And I think India really needs to take this on board, particularly in the festival season and on your billboards, that they've come up with this mnemonic called a civic duty, which basically you need to avoid crowding indoors, low ventilation, close proximity, crowds of people close together for long durations, particularly, of course, if they're unmasked and if they're talking, singing, yelling, or breathing hard, like doing, exercise, for example. So, I mean, lower risk activities would be things like being outdoors. Now, I know in India and particularly in North India, that's difficult at the moment when pollution levels are high, that you should wear masks and that they should fit snugly. And you should wear them even when you can maintain a physical distance, particularly when you are indoors in these high-risk scenarios. And the other thing which is very, very important that we need to think about is about ventilation and cleaning of the air by filtration, because that will help, reduce the number of concentration of, infected aerosols in the air. Now, this was an excellent visualization, which is a Swiss cheese, the cheese with holes, which basically shows that, in order to, why are there so many different behavior things that we are asked to follow? And that's because no single intervention alone is good enough, because each one could have a flaw. So that's why we need to, have multiple layers of, protection or precautions that we take, so that we can maximally protect ourselves. Because as we've seen, sometimes even at, doing the best things, people can get infected because, all those flaws may line up as they're showing here. So some of these responsibilities are personal, and, they're the ones that we as individuals need to focus on and do. And some of them are shared responsibilities, which I think we can discuss later on. So the personal ones, as we've highlighted, are, physical distancing, staying home if you are sick, wearing masks, hand hygiene, as in washing hands for 20 seconds with soap and water, or using hand sanitizers, cough etiquette. So coughing or sneezing into your elbow is very important. Avoid touching your face, and I've coined this term, A.M.E.N. Wear masks, A.M.E.N. Avoid, whenever you go out, think, avoid my mouth, my eyes, and my nose. Wear masks, A.M.E.N. Namaste. Namaste for greeting. No handshaking, no hugging, just namaste. And A.M.E.N. I want to avoid my eyes, my nose, and my mouth, and keep saying it and teach your children. And if you're in a crowd, limit your time. That's very important. In terms of shared responsibilities, we need fast and sensitive testing and tracing when cases are identified. Especially when you look at things like schools opening, organizations and offices need to look at ventilation. They need to look at air filtration. That we need to have government messaging and financial support. And you need to have quarantine and isolation facilities, and of course, vaccine developments. So that is a very important way to think about the reason we have to do all of these different things. And remember, the goal is to try and get that reproductive rate to less than 1, because if we break the chain of transmission and, one person is not spreading it to, 2 or 3 people, and they're spreading it to less than 1 person, the pandemic will stop without a vaccine. That is why these measures are called a behavioural vaccine. And if everybody does these measures, as we said, over 80% of people do it, then we can stop this pandemic. So in terms of, any public health action, prevention is better than cure. In fact, prevention is the cure in terms of COVID. We want to be able to safely navigate this pandemic, and we want to be able to prevent ourselves from getting COVID until such time that there is a cure. So, as I said, our individual responsibility will basically mean that, collectively we will be able to, vaccinate ourselves, our society from this, pandemic. Just if we follow these rules of, social distancing, wearing masks, washing hands, and staying home if we're sick. One of the previous speakers spoke about, culturally appropriate, songs or things which can basically help people understand. And this is absolutely a correct idea. And for my previous presentation to NIDM, I made this little hand washing video, which didn't take me long to do, but because in New Zealand, that we were told, we were, educated at the beginning of the pandemic that whenever we wash our hands for 20 seconds, we need to sing happy birthday to you twice. And it's very important because, this is fundamental. you need to wash your hands properly. And so I tried to make a culturally relevant video for my Indian audience. And so I just wanted to, and this sort of video should be shared widely on TV channels to educate people how to wash their hands properly and to teach them that they should be humming something so that they don't rush the process. So yeah, I mean, I don't know if anybody. I mean, we can all do with a reminder of how to wash our hands properly. So something like that, I think, would be very useful. And as I said, remember to wash your hands and avoid touching your mouth, nose, and eyes, because you have to think that that virus. I do not want to allow it to enter and gain access to my cells and start replicating. Then, of course, is the maintain practice physical distancing while remaining socially connected. So we have many modalities to remain socially connected. Although humans love, the physical touch, I think one of the reasons India did quite well compared to other countries initially is because we have this in our tradition. We say namaste, and that is a very heartfelt greeting. There is no need for shaking hands and increasing transmission that way. Now, the masks is a very, very important thing. And, you can look at masks as basically like, now we're at a stage in the pandemic, particularly in India, where, it's very unlikely or feasible that you're going to be doing a lockdown. So the mask is our, personal lockdown. It's our personal lockdown where we're locking down our nose and our mouth. And this is a very, very important tool for people to understand how important it is. Because as you can see in this diagram, if two people are not wearing a mask and one of the persons is infected, there is a 90% risk of transmission in that interaction. Whereas if both people are wearing a mask, that risk of transmission falls to 1.5%. And then if you add in the distancing, it's virtually zero. Of course, now we've got this whole aerosol issue where, even if you've got a mask on and you're in a prolonged period of time in an enclosed, non-ventilated room, you still have risk of, getting infected. But the important thing to realize is that through wearing this mask, you would have not only reduced your chance of getting the infection, you would have reduced your viral load. So as I explained, that is extremely important. And in fact, now that's been proven that countries that had mandated mass masking actually reduced their rate of hospitalization. And I'm sure this is what has happened in India as well, because this led to more asymptomatic or mild infections because people were getting a lower viral load. So wearing a mask is 100% common sense and everybody must do it, but everybody must do it properly. So, masks, they are the single most important tool in this pandemic to save both lives and livelihoods. Because as I said, it will reduce your chance of getting infected. Even if you do get infected, it will mean that your infection will be less severe than had you not been wearing a mask. And it will preserve people's livelihoods, their ability to earn money, because they can still go about and do their business because of the fact that they're going around with that personal protective bubble. Now, lockdown. Now, it's very important that your hands must be clean before you, take off or put on your mask because you don't want to infect yourself. While you're out and about, do not fiddle with that mask and make sure it covers your nose and your mouth, a fabric mask is fine, a 3-layer cotton fabric mask. Think about the environment. We're talking about waste. We do not want to create another environmental disaster. So, you can use a cloth mask, you can come home, you can take it off and put it for the hot wash dry it well, and have it ready for the next day. Have several. It's fine. They work well. Do not wear a mask with a vent.
Dr. Sandhya, we have Dr. Bhargava also joined. So can I request in 5 minutes to share your,
So, and again, we need to take precautions to keep our family home safe, in a safe bubble. So keep those ones that, loved ones and elderly in our home safe. So keep our, bubbles small. Now, one of the points was that we need to be able to clean and disinfect properly. Again, I have videos on this on my YouTube and on my social media, how to make up correct disinfecting solutions in spray bottles, and how you need to clean the surfaces properly, so that we are making sure that we are doing, everything we can to reduce our chances of becoming infected and making sure that our environment is clean. Now, the next point I wanted to get on to is, if you actually have COVID, I mean, I know this is about, awareness about the behaviours for avoiding COVID, but it's also important, I think, to address the fact that a lot of people are getting COVID at the moment, particularly in India, and that if the way you modify your behaviour, if you think you have COVID, will also be a very important education for everybody, so that also will help reduce the, the rate of rise. So it's very important, if you think you have any viral symptoms, and as we're coming into winter, people will get even a common cold, but rather than thinking, oh, it's just a cold and I'll go out and it'll be fine. No, any viral symptoms, you have to assume that you have COVID, and you have to stay home and isolate yourself from your family straight away and start wearing a mask. Because one of the biggest places where COVID is transmitted is in the households, and you are most infectious early. So, you need to isolate yourself straight away from your family members, and, stay home and get tested and seek medical advice, and wear, masks and practice strict hygiene at home. So as Professor Kumar mentioned, I recorded a video in June for my family members in India particularly, and around the world, looking at the situation where basically a lot of people were facing, where, getting infected with COVID, yet not being able to access testing or hospital level care, and a lot of panic. And so this was my disaster management plan for how to, stay calm and prepare yourself should the need arise if you or your family members were to come down with COVID. And so I now have, through the help of, through the, massive global response I've received, I think this video has been seen probably in the hundreds of millions of times via a WhatsApp all over the world. I have, been dedicated to this project of getting this advice, dubbed in several languages, and now I have it in Hindi, Telugu, Tamil, Gujarati, Marathi, Bengali, Punjabi, French, Portuguese, Spanish, and Russian. Now, apart from Spanish and Russian, I know that all those other languages are spoken in India. I think the other two that I'm working on are Malayalam and Kannada. And in these videos, in this video, I have basically explained the basics of COVID and prevention, and how you manage, the infection optimally at home, and try and prevent a mild infection from becoming severe. And I would, recommend that everybody take a look at this video, because it will go a long way in helping you feel empowered to manage. Because, the truth is that, much, better resourced countries are facing this exact circumstances. So assuming if, things go ahead, and, and that's why this Janandolan and, raising awareness and reiterating the importance of behaviours is very important, because we do not want to be in this situation where, the health system collapses and the only thing you have to turn to is this video, which has happened to a lot of people. But the good news is a lot of people are getting better following these steps, because it's based, what I've done is I've based it on very, very good science, and all the evolving evidence is supporting all the steps. So, I mean, these were the sort of things that I went through. Now, the first step in my video was talking about priming and boosting your immunity. And I wanted to just talk about that in terms of, as we head into the festival season, and in terms of long-term risk mitigation against this pandemic, is that it's essential that we all work on, building our immunity and a healthy lifestyle. And very important is to avoid vitamin D deficiency. Particularly in India, there's almost universal rates of vitamin D deficiency, and that has been proven to have a very bad outcome if you are infected with COVID. The other thing is, I mean, in New Zealand and in Australia, and people will look to the Southern Hemisphere and how they've managed to get through winter and not done too badly with COVID. You have to understand that these countries have high rates of influenza vaccine, which doesn't protect you against COVID, but it protects you from getting a co-infection with the flu and with COVID, which would lead to a bad outcome. So, I mean, that's something for, people in India to think about. There's also, pneumonia vaccines that we give to elderly people. So, and maintaining a good control of any chronic health conditions you have. And using food as medicine. It's not that you need to pop every single vitamin, but try and focus on a healthy diet with whole foods. And in terms of, the long marathon of COVID, it's very important for our immunity that we focus on good mental health and mental resilience. And, the basics of doing that is basically eating well, sleeping well and having a regular routine, exercising regularly, staying connected with family and friends in a safe way, minimizing stress, through yoga, mindfulness, and avoiding, alcohol, smoking, drugs, binge eating, all these things which will, reduce our ability to fight this infection. So this is a very important risk mitigating strategy, and for the host or for us, and will help us, survive this pandemic. So these are, the second step in my, video that I describe is the importance of reduction in viral load, and as I've explained, that, and I'll talk about nasal and throat rinsing with saline and betadine and demonstrate that. And the third thing I talk about is breathing exercises and the prone positioning, which, I demonstrate balloon blowing, which helps simulate what a ventilator does and helps keep your lungs open. Now, particularly, I would bring that these breathing exercises are important, and I know that the pollution levels are quite high, and I've read also that a lot of people that suffered COVID in the first wave in India are now preventing.
Dr. Sandhya, can I request you to kindly sum up so that we can have
Sure.
some of your points during the question answer session?
Yeah, just the point with I was just saying, okay. I'll just say with the breathing is that, people that had a mild infection initially are now coming up with breathing difficulties post-COVID because of pollution. So these breathing exercises are important for everybody. So, in terms of the long term, I'd say, as I said, no herd immunity. We've got to stay calm and carry on with, the precautions and try and avoid reinfection, even if you've already had COVID, and that we need to mitigate our risks by basically, following all the rules for the, behavioural or social vaccine for COVID, which is wash your hands, watch your distance, wear a mask, and I would add, watch your ventilation. So they're the basic points that I wanted to highlight.
Thank you, but I would request you to kindly be ready with your video so that we can, at the time of question answer, I can take up your video as well. So thank you very much for giving this a very, very informative and very, very illustrative manner, your presentation, especially in the context of Honorable Prime Minister's Janandolan, where he is talking about that every individual should become responsible and self-reliant when it comes to the management of COVID. And the actions which you have suggested are very, very important for individual and also becoming an individual kind of a responsible citizen at the time of festive season. I would get back to you, Dr. Sandhya. I'm not concluding here, but I would like to welcome Professor Prof Bhargava, who is Secretary Department of Health Research, Ministry of Health and Family Welfare, and also Director General of Indian Council of Medical Research. Professor Bhargava is also a cardiologist, very, very senior cardiologist at All India Institute of Medical Science, which is, that All India Institute of Medical Science is widely known as a kind of a very good research and treating center as a hospital. And India feels always proud in this hospital, that kind of cases they have been able to handle. And he's also executive director for Stanford India Biodesign Center, School of International Biodesign. So this is a very, very important scenario when we are into, when we talk about entire scenario that how we are facing with. And when it comes to that, if people are not aware and they get affected, they have to rely on the hospital facilities. And you said, Dr. Sandhya, that don't load hospitals with the kind of, without taking precaution you have to have. So I would welcome on behalf of the Ministry of Home Affairs and also on behalf of the National Institute of Disaster Management, National Disaster Authority, to Dr. Professor Bhargava for giving insight that how India's hospital facilities are prepared at the time of COVID, especially when we are having a lot of, then winter is coming, pollution is an issue, and also then we are talking about festivity. So in this concern, people behaviors are different. So that precaution is at one go and then it happens. So I request you to kindly deliberate upon this. You are welcome here, and I request you to kindly give your insights.
Thank you so much. Thank you so much. I think we've had an excellent talk by Dr. Sandhya. What I will talk briefly is about what we have done for this pandemic in the last 8 or 9 months, and how pandemic has not respected any country borders, and why we have had these pandemics. Now, if you look at this millennium, we've had the pandemics of Zika, the epidemics of Zika, 2 epidemics of Nipah. We've had SARS, we've had MERS, and now we have had this COVID-19. We're seeing that these epidemics are becoming more frequent. They're becoming more complex, and that is because of the fact that there is the change in environment, there is the ecological change, there's rapid urbanization, and there is extreme connectivity between cities and individuals having too much movement on the globe across. And that is why we probably are seeing, and the expenditure on public health has been very low all across the world, including India and many countries. Public health spending has been very low. So this remains a problem, and we will see more such epidemics in the future unless we are able to improve our environment. Having said that, the approach that India had done up till now was a sort of a very proactive, a preemptive, and a graded response, which was very calibrated, whole of science, whole of government approach, because of a very strong leadership. We continued to play with the 5T model of test, track, trace, treat, and use of technology. We did not mess around with herd immunity business at all along these 8 or 9 months that we've had this pandemic, and some nations have suffered because of that. But we took the learnings from those nations and were able to not play around with herd immunity. And as we speak, we see that the national seroprevalence last month has demonstrated that the seroprevalence is 4% across the country, while across the urban areas, 4% in the rural areas, 8% in the urban areas, and about 15% in urban slums, with a national average of about 7%. And it has increased from 0.7% in March, April to 7% only. So we definitely do not believe in herd immunity for this at the moment, clearly. And we will focus on our COVID appropriate behavior. We will focus on the masks, the use of masks, and the use of social distancing. The COVID appropriate behavior is inexpensive. It doesn't cost anything. Masks are also very inexpensive, and they are nearly as good as any vaccine as we speak. So till such time, and even beyond the vaccine development and the vaccine production and vaccine availability in the country, we will have to use the mask and probably masks will be the last things to go, or maybe never go. So that's how I would say. And I'll start with some slides if I can share a presentation. Yeah. Can you see the slides, please?
Yes, yes, we can see that.
Okay. Okay. Yeah. So as we speak, we have say about 42 million cases across the world with 1.1 million deaths, and in India is about 79 lakh cases with 1,21,000 deaths. And our strategy has been 5 T's, as I mentioned: test, track, trace, and the use of technology. Now, our principle when we had this epidemic was to have a laboratory in every district of India.